Dr. J. Ganesh, consultant physician and diabetologist, Chennai. So we're going to discuss about hypertension today. So the basics of hypertension. So everyone has some sort of blood pressures in the in going on in the blood vessels. So usually it is 120 over 80, but it can vary from time to time. It is a normal blood pressure recording for anybody. But due to some other factors, gradually for some patients, the blood pressure, the pressure exerted for the blood vessels to increase over time gradually. And we call this as hypertension or high BP. All these things we call. So this is called termed as systemic hypertension. This disease is quite common nowadays. It has become very, very common. We do get patients even at much younger age, like 20s and 30s. We start to see patients having hypertension. So hypertension is very, very prevalent in India. And so many reasons are there for it being very, very common. The first and foremost reason is lifestyle changes. Now, mostly the dietary pattern has changed a lot. It has a lot more westernized than before. That's a very important reason. And then lack of adequate sleep, and then stress, so much stress in work and family, all these things. And then salt intake has increased very much. So salt intake is one, solo factor, one single factor, which can cause blood pressure to go really, really high. So I think salt intake has increased a lot due to processed and artificial food. These are the reasons why we are seeing high blood pressure, that is hypertension, very commonly than before India. So this is the current scenario. Several million people, I think around current data, 200 to 300 million people in India are affected by hypertension. Symptoms, how do they feel? They don't feel anything. So initially, as the BP, picks up, at early stages, you don't see any symptom. By only random checkings, screening, we find out. But at later stages, there may be some symptoms like headache, dizziness and so on. But we don't expect the symptoms in all the patients. And then it can affect all the organs. Why it is very important? Let it be the hypertension. If it is, it's no symptomatic, it's not causing any trouble. What is the problem? So many patients do ask, I look normal, I feel normal. Why should I take medications for hypertension? Hypertension is a slow killer, it's a slow burner. It affects all the organs in the body, most of the organs in the body, like eyes, brain, heart, kidney, and so on. So many organs, and it leads to many diseases like heart attack, stroke, and kidney failure. So definitely, hypertension is a slow killer and is a silent killer. So it has to be treated whether the patient feels the symptom or not. That has to be educated. So we need to impart a lot of knowledge, education to our patients regarding hypertension, because this is a huge problem currently we are facing. And treatment-wise, of course, as 2 or 3 times, the physician, the doctor confirms the blood pressure, and then, he puts on the medications. Of course, the first and foremost treatment is lifestyle modification. Of course, BP, develops due to lifestyle changes mainly. So predominantly, restriction of salt diet and other fast foods, and having a good exercise and having a healthy life, stress-free life with adequate sleep, and quitting the smoking, these things, and all is the first and foremost, first line of treatment. And then comes the medication. There are many medications in the current scenario. So many new molecules are also there, for the treatment. So the doctor decides for you. So only thing is the treatment has to be continuous manner. It's not like a short-term treatment. You have to continue for longer time. And of course, with diet and exercise, so you can reach the target. Because if you can reach the target and keep the BP under control, we can make the BP patient, or it is the hypertensive patient, to lead a normal lifespan like any other patient. So clearly, hypertension is a very much controllable disease. Only thing, the awareness is the key. Uh, of course, education is the key. We must get educated ourselves, make the patient, or the relatives of the patient to understand about the nature of the disease and these implications and complications which it can bring it upon the patients, which are deadly. But only thing, it takes time to develop. It's a slow burner. So that thing is very important. So we must uh, diagnose early and keep it under control for a long duration of time. That's the key. So with that note, I conclude my this short talk on hypertension. Thank you, everyone. Thanks.